Hello, everybody. How are you doing? Happy Friday again. Well, thank you very much for attending my live shows every Friday at 12 noon. Today, we are going to talk about a very dear topic. It is very common topic about IT expenses, and actually, IT and computers is not my domain, but I have been working in healthcare IT for last 20 years. And because of that, I have learned a lot of lessons. I have gained a lot of experience solving the problems in medical groups. And I have seen from Windows 2000, evolution from Windows 2000 servers to now Windows 2021. It's almost 21 years. And some of the servers I have managed it myself. I have hired people. I have managed large teams. And we have also managed a lot of integrated solutions with medical between medical groups and IT vendors, and we have integrated several softwares and hardware solutions. So all of this, my experience in last 20 years enables me to give a solution for year 2023 because we have been seeing a lot of changes coming to medical groups and especially in IT side. When we talk about artificial intelligence, we talk about chat GPT, and I have recently attended HIMSS in Orlando, and a lot of doctors have these questions. How are we going to handle the cost, the rising cost of IT, and especially in the medical groups? I tell you, 6% when Medicare pays the reimbursement to a doctor about each claim, 6% of this, which has increased from 3% to 6% in last 10 years, 6% of that medical reimbursement for each CPT code goes towards the IT cost. Medicare assumes that this is a cost of an IT or managing IT. And guess what? The IT expenses are in some medical groups are even more. It's not even 6%, they go up to 10%. I'm going to share some numbers with you and then a story because I know you love the stories and everybody loves the stories. So today's topic, we are going to talk about rising cost of IT in a medical practice and how we can help reduce it, how we can reduce the cost of computing in the future, and especially when everybody is talking about uh, cost consolidation, cost sanitization. We already spoke about that the cost alone Medicare reimbursement dollar is 6% of your medical reimbursement. So what that means is each penny, every reimbursement you get, a doctor gets for each patient, 6% of that is considered as an IT cost from Medicare. There are three areas I want to focus upon today. And then before that, I'll give you this study is coming from MGMA. So if you see that graph, 70% of medical groups, they reported their health IT compliance experience expenses has increased in the past year. Now, think about it. This is after a gap of 20 and 21, 2 years due to COVID. In COVID, some expenses went down, but some expenses went up, especially when we talk about the remote workers, employees, VPN, setting up remote accesses for your employees, that has gone up. So we'll talk about three things, as I said, and the three first and foremost, and which is my favorite subject, is whether you want to have a server or you want to have a cloud. Most physicians were planning to, or who are contemplating what would be the moving forward, their EMR or their practice management infrastructure or patient medical records they should sit on. They compare the cost of managing in-house servers, or they compare it with the cloud or outsourcing it completely to the cloud. I tell you, this is a long Very, very long debate because everybody has their own priorities. Nothing is, of course, managing your in-house servers may be a little costlier, it may be a little more riskier, but in a longer run, you control the data. You have the data in your own hands. Whereas if you outsource your data, if you go on the cloud, you have no control, you have zero control over your data, and you are married for the rest of your life. So that is the basic fundamental difference whether you keep your data, your patient records, your charts, everything in house on your own servers, or you outsource it to the cloud. Here is an interesting twist in year 2023, which is very interesting because most server-based solutions or EMR companies are now moving from on-site servers to cloud, or I would call it a private cloud. So solutions like Amazon AWS or Azure, Microsoft Azure, Microsoft Cloud, these are the pretty much two cloud-based solutions which are available. So you can buy your own space and you can move your infrastructure to your own cloud. Again, in that case, yes, you can continue to own the cloud space. Hello, everybody. Sorry, this, I don't know why this does it. Every time you send a stream, it doesn't, but I hope you can hear me now. I don't know whether I can. Is it showing me online? Let me see. Okay, and I'm trying to. Okay, yes. So you can listen me. Okay, perfect. So the point I'm trying to make is you have to decide whether you want to have a server, you want to have a cloud. In both scenarios, data belongs to you. But if you try to just outsource it to the cloud company, which means that your data sits with your EMR company, and your EMR company charges you, let's say, some percentage, maybe X amount for your managing or hosting your EMR and maintaining it for you. There are two primary areas where you would have a problems. The one, the speed would always be slow, no matter how fast your internet speed is. Even if you have a gigabytes of connections, you would always have problems when it comes to speed. And for some reason, if your internet is out, then you have no access to your patient records and medical records. This is number one issue when you decide about the server, your in-house server or a cloud. Because in this scenario, the main thing, the main problem is your connection is based on internet. If you have no internet, you have no solution. So that's a one and most important thing. If you are in the area where internet downtime is less than like 1%, you always have good amount, good internet, you have no problem in having an internet connection. And if you're a small office, this may be a viable solution not to have your own server. But it's not about just that. There's two more things which are important here. One, do you only need that one server which is hosting your EMR, or do you need more servers? Because typically in a 5 to 10 doctor's office or a small office, you would need a server to manage like AD, Active Directory. You would need a server to manage your faxes. You would need a server like a file server, a small file server. So you would anyway need a server to manage some of your critical operations. So if you need a server to manage some of your critical operations, and cloud is not an answer for that, then why not just have the same company manage your entire infrastructure and run those servers? Because uh, the cost of hardware is going to be the same. The cost of server hardware is not going to be cheap if you do not decide, if you partially decide to outsource some of your on the cloud and you decide to have some of the servers in-house. Unless you have such a huge large operations that you just cannot, it's difficult to manage in-house. So that's one and most important thing. So you better decide about whether you want to have a server or a cloud. Now another twist to that is How are you going to manage your personal cloud and a public cloud? So you have to have some kind of knowledge about picking up a cloud if you're going with Amazon or you're going with Microsoft, and who's going to have a control, how you are going to have a control as your, as a practice. You have to decide that. Now, when we are talking about artificial intelligence, natural language processing, and chat GPT, integration of all of those things in next 10 years, a lot of these things would be purely based on cloud. It would be very difficult to run some of those processes in house. And when this happens, eventually you would have to decide what part of your EMR you want to host it in house and what part you want to outsource it. But at some point, for some of these operations, if your practice goes with AI, artificial intelligence, chat GPT, and some of those new processes which are being introduced, even patient portal. Let's take an example for ECW, eClinical Works. A lot of people use that. So half of eClinical Works, you can keep it, your practice management side, your EMR side, on site at the server. But when it comes to patient portal, when it comes to run certain processes which are run by them, you have to outsource it on their cloud. And they do it. They sync the data, they keep some of the data on site, and they keep some of the data off site. So, anyway, you are following a hybrid process in that case. So, again, this was a very important thing. In the year 2023, it is going to be either fully cloud based, or you have to find a solution which is at least a hybrid solution for your data. So that's one first, most important thing. You have to decide, year 2023 moving forward, you want to lease the space, how do you want to do it, or you want to buy your own hardware or server. Now, second most important thing is cybersecurity and compliance. And I tell you, in last 3 years, I'm going to share some data with you. So the cost has shifted from hardware to compliance, from computers to compliance in the last 15 years. And this is the biggest change I have seen. So if you see in the year 2008, the cost of hardware, if you see this green, used to be very high. We used to buy these Dell computers, servers, networking equipment, all of those stuff for medical practices. Software cost was okay, but in 2014, because of these all the new EMR, Obamacare, all of these practice EMRs, practice management systems, the cost of software has gone up. Compliance was not that high at that time. When the HIPAA rule was introduced, compliance has become more relevant. And then in 2022, if you see pretty much hardware, a lot of people have shifted from server to cloud, but at the same time, the compliance cost is also going up. In year 2023, I see the cost of compliance, which means protection from cybersecurity, protection from cyber threats, protection from ransomware, insurance cost. Even some practices have these errors and omission, professional liability insurances. All of that cost is going to be very high. So if you see how this is moving, present hardware cost is absolutely negligible if you are going with the cloud. Software cost is also negligible because most solutions are based out of monthly cost, like SaaS software as an application, or service cost. But the third thing, which is most important, is compliance cost is going very high. You need to buy very expensive antivirus solution, ransomware solutions, online backups. You have to protect your medical practice from potential lawsuits for against HIPAA. You have to protect your medical practice against the lawsuits which can protect you from different kind of lawsuits from ransomware. So you have to decide in that scenario. This is where the whole scenario is moving from hardware or computing to compliance, where you have to invest a lot of energy, time, and money on compliance. And that is one of the reason in last 3 years, if you see the general operating expenses per FTE physician, like full-time executive physician in multi-specialty group, it has increased. In physician owned, the cost of IT has increased because of the compliance and cyber threats. Physician owned practices, if you see from 2019 to 2021, the cost of IT has gone up. But the hospital, if you see the hospital, the cost of hardware has gone down because they have a full-time staff who manages. And especially in the environment, it's not the cost of hardware which has gone up, it's the cost of managing the hardware which has gone up. So a lot of these expenses are towards finding the IT people, expenses towards managing IT resources, managing backups. Even if we see it at our side, our cost of IT has gone up. And I'll give you certain examples. Like in year 2022, there were 35,000 new complaints of alleged HIPAA rules and high-tech act violation. 25% increase from complaint received in 2020 to 2022. And out of 27,000 resolved complaints, the majority, 20,000, were resolved even before initiating an investigation. That means settlement. And they don't consider settlements as a part of insurance litigation because that was resolved much before the investigation takes place. So what happens if you have a HIPAA liability insurance or any kind of professional liability insurance which protects you from potential lawsuits for cyber threats? They normally do the settlements even before somebody complains and the complaint even starts investigation. So this is what happens. Now in 16% only cases, 4,000 cases where it was determined that technical assistance rather than launching an investigation. So there was some kind of IT glitch or some kind of technical problems which was there. Hacking and IT incidents, they represent the largest reported data breaches. 2020, 75%, with the largest incident involving network servers. So like I was talking about whether you should have your own server or cloud, that is the biggest risk you carry. If you have your own network servers and they are not managed by a proper IT company, you are exposed to potential lawsuits or potential threats. Risk analysis and management were cited as a crucial areas for improvement. So any kind of consulting business or you are into risk analysis and management business, this is a huge opportunity for you if you are if you know CIPA security rules standards, if you do like CSR, well, not CSR, I mean security risk analysis, SRA analysis in medical practices. It is very important that medical practices follow the guidelines and recommendation if you have a SRA, annual SRA in your medical practice, because it is mandated by CMS. So again, a lot of shift is happening from hardware to consulting because of these reasons. Now, where is it going? Right? Where is it going? Tracking. So I'll give you an example what happened recently. One of our clients, they had a ransomware attack, cyber attack on their entire network. Of course, they had the local in-house servers. We have been managing their servers for last 10 years, and it's a very interesting story. Whenever a ransomware attack happens, you typically have to pay a lot of money to eliminate it. But the easiest way is if you have online backups, you can always restore your backups. But your backups are secured or not, that you have to see. Most of the times, you have the backups which were taken without a password and without an encryption. So, what happens if you have ransomware in your original data and it was backup, your backup also has a ransomware or has a virus. So, even if you restore the backup, it is not going to do anything good. So in this scenario, since we were managing their online backups and the online backups also has an encryption, we were able to save the data. But they had a loss of patient time because they had to keep the office closed for 2 days because the data was in like terabytes. So in order to restore the entire data, it took us almost 24 hours. from the last backup. And guess what? If we are not careful, and if the data is not um, the real time, they lose some of the data from a previous day. So in order to have this whole thing work, it takes 3 to 4 days before it gets restored properly, and the practice. And on the top of it is a lot of stress for everybody, because nobody knows what data is sanitized and what data is without ransomware. So yes, it is a little bit, the managing data and restoring the data. You can protect the data by keeping an online backup. We were using Acronis software, which was a good software, and we were having an incremental backup set up properly. So we were able to get the data back because of the ransomware attack, but it cost them almost like 2 or 3 days of without seeing patients. But at the same time, we were able to protect the data. So sometimes you have to see the cost or expenses may go high because of these cyber threats, but at the same time there are solutions available which also protects you. So even if something happens in this direction, and if you have a good consultant or IT company, they can manage it very well. Earlier, so again, MGMA, I will quote it because they're my favorite group. So they just did a stat poll, and they said in 2022 the found IT related expenses is the second most common expense from a medical group books, like medical groups, accounting books, after the drug supply. So the cost of non-labor expenses has increased tremendously in year 2022. And this is the top rising expense category. So again, just because somebody is managing it properly, it does not mean your cost will go down. Your cost would stay same, but you have to really, really stay on the top of it. The team is so the another thing is what I spoke about is when you had a ransomware attack, 2 days of work was gone bad and you could not do anything. Doctors just went on vacation, maybe a mini vacation for 2 days with their families. So the same thing, the supply disruption to hardware for their IT systems. This could be a potential. It can have a lot of postponing and delaying, all of those things. So what can you do to protect all of those things, right? Third and most important thing, what happened in some of the scenarios is because of COVID, people started working remotely. So setting up remote workstations, setting up HIPAA, compliant remote workstations, VPNs, all of this requires a lot of cost. So this was also a rising cost in last 1 year. A lot of people wanted to go with a new system. So whenever you move a system, the cost of move from one EMR to another EMR, it's not easy. And I tell you, I have been doing this for past 20 years. There is no easy way to convert your data from existing EMR to a new EMR in a flawless manner. It just simply don't exist. You still, you have, we are living in an artificial intelligence world, but it is still the time when transition of EMR is not easy. So having an EMR is like a one-time marriage. Stay there, be very sure that this EMR is serving your purpose, and do not even try to change it unless there is a tremendous cost of improvement in future or something which you're looking at. Okay, so now we'll talk about. So we talked about server and computing, we talked about the hardware cost and software cost, and we talked about the compliance and cybersecurity cost. What can we do different? What can we do different to reduce the cost? So I'm going to go over one slide. With that slide would basically give you an idea of what are the solutions you have in front of you. And that slide will take probably another 5 minutes and we'll finish it in 30 minutes. And then if you have any questions, you can ask me. So these are the solutions which we have deployed in a medical group. And I'm going to show you this screen. These are the solutions we have talked about and we are going to talk about. Amazing solutions. You have to decide about server and cloud in year 2023, you have only two solutions. You want to go with Amazon or you want to go with Azure, Microsoft Azure. Discuss with your IT guy, see what you can do. Again, I have talked about it, so you can decide based upon your priorities, cost, your comfort level. Phone system. So traditional phone system, physical analog lines are moving to VoIP, and there are so many VoIP-based phone systems are available in a medical practice. The best scenario would be if you can implement a VoIP-based solution. We suggest 3CX. That's what we use, and we have been very happy with that. The best scenario is 3CX is a hybrid system. You can host it on your server, and you can also host it on the cloud. If you are a multi-location office, host it on the cloud. Everybody, multi-locations, everybody can have the singular one network with one extensions, and you can give thousands of extensions. It's not a user-based pricing. It is a user-based but concurrent user-based pricing, and that is the benefit of this. A lot of these small VoIP-based companies who gives you the phone system, they charge you a fixed rental per month for their phones. This is, you have your own VoIP-based service, and then you deploy that service in your traditional phone systems. But again, we find it better, and you can do a lot of innovations in future. You can integrate AI, chat GPT, all of those things. So it's a very progressive company. Third thing, if you want to eliminate all HIPAA related goof ups in your medical practice. So think about it. If you're sending a medical data on emails, if you're sending faxes, if you're communicating internally in your office through email, it is not HIPAA. There are offices with multi-location, and you have a lot of people who are managing these offices, and a lot of internal communication is going on. Have an internal CRM, which is HIPAA compliant. Bittrex 24 is a free CRM. You can pay a nominal fee and you can buy a HIPAA version, which is, again, safe, secure, use an internal CRM. Three, we have talked about these three things. Fourth thing, computers with professional windows and user-based licenses. So I have seen a lot of these doctors' offices, medical offices, they use home-based laptops. They go out, buy something from Best Buy. It is not going to work out. Buy a good professional Windows license. Whenever you ask or order a computer, order with a professional Windows license, and it comes with the Office 365 license, which is tied to your email. Use that. So never make a mistake bringing your home computer into the office and use it. It does not have the features you need to protect your medical business. Fifth, antivirus or anti-ransomware. Now, this is very important. Do not depend on the free antivirus which comes with the computer. It will always going to fail, and it is not going to work when you would need it most. And that's why the most ransomware attacks happens, because what happens in 90 days, you don't renew it, and it just, the service dies, expired, and then you get an attack. So we suggest we use Sophos. We use Sophos in the entire network for doctors, for servers, for everything. It's a user-based license. Again, these all things are going to cost you money, but they are going to protect you forever and for future. So great solutions, you can use it. Fourth, secure email. And again, we spoke about internal CRM for internal network for your employees, but for external network to communicate with your patients, to communicate with doctor's office to another doctor office, different offices, you need a secure email system. It is very cost effective system, just $50 a month, one user. You can use Citrix email. I would suggest everybody to sign up. It's an online service. You can Google it online. It's Citrix email. Citrix. Use Citrix company. Citrix is a very good company. They make very nice secure emails. You should be able to sign up for that by yourself. My favorite, cloud backup. So if you have an if you have an internal servers, you have been managing those servers in-house, or you have a company, ask them what kind of online backup software they are using. So far, we have realized the best software which is available in the market is called Acronis. We have used it. It's a little bit expensive. It comes with a yearly subscription price, $1,500 to $2,000 a year, but it keeps your data absolutely up and running, and it does the snapshot. The best feature of Acronis is it does the snapshot. So even if everything goes down, everything is destroyed, damaged, your hard drive is crashed, you can always reinstate your servers back. How are we doing so far? Good. Okay, just two more solutions and I'm going to be done with this today's session. Fax servers. So a lot of these fax solutions are available. Online faxing is available. Make sure they are HIPAA compliant. But at some point, you have to deploy them on your computer. So you have to use the fax using your computer. So when you use that, then make sure your computer Windows license, your people in your office, they know how to manage it and they will do it well. Last and most important in today's environment, patient communication portal. Patient portal has to be HIPAA compliant, or if you're using a patient communication SMS, never send or never use your phone to send a message to your patients. Never do that. There is patient communication services which are available. This feature is available or a part of your EMR. So if you have an EMR, you have a practice management solution, you can always rely upon that, because that's a HIPAA compliant secure texting from your computer to patient's phone. So these are the 10 solutions. 1, 2, 3, 4, 5, 6, 7, 8, 9. 9 solutions. We talked about 7, but I've given you 9 solutions for your amazing medical practice in year 2023. Do these things, and I'm sure you can protect yourself from potential ransomware. You can protect yourself from potential HIPAA liabilities, anything in future. These are the best solutions which are available in year 2023. Yes, your cost may go a little up, but your cost towards your own protection for future will go down. Thank you very much for listening to this. Happy Friday again. Have a great day ahead, guys. Thank you very much. Thank you so much again. Thank you very much.